I have so much to tell you about. I've got some personal updates, community updates, and an inspiring face to face conversation with Kamala Harris about my book that's coming in just a few months. You're listening to the PHEC podcast, episode 463. Welcome to the Public Health Epidemiology Conversations podcast, where we dive deep into the topics that matter most to public health professionals creating change in communities around the world. I'm your host, Dr. Charlotte Hughes Huntley, and today it's just you and me as we explore a topic that bridges different perspectives with the practical wisdom you need to fuel your impact. Greetings, everyone, and thank you for joining me on this episode. I'm your host, Dr. Charlotte Hughes Huntley, and today I want to do something a little different. I want to reintroduce myself. Whether you're brand new to the podcast or you've been here since the beginning, I think it's important to pause every now and then and remind you who I am, what I do, and why I show up every single Tuesday. I recently wrapped up a month of travel that included reflection and intentional slowdown. It was a space to breathe, reset, and remember who I am outside of the work. I'm coming back with fresh eyes and a lot of clarity and honestly a lot to share. So let me start with who I am. I'm an epidemiologist and entrepreneur, showing up as a public health consultant, podcast host, and now author. My consulting firm, Dr. C.H. Huntley, LLC, partners with large nonprofit organizations, government agencies, and tribal nations on strategic planning and implementation. In plain terms, I help organizations make sense of their health information, communicate it clearly, and put their plans into action so it leads to real impact in the communities they serve. And of course, there's this podcast. Public Health Epidemiology Conversations has been publishing every Tuesday since 2017. And the PHEC podcast community is where the conversation continues between the episodes. I also host a second podcast. I run a separate business called Public Health Entrepreneurs, where I support public health professionals building their own consulting practices and businesses. On a personal note, I still am navigating grief, and I'll share more about that in a moment. I also want to tell you about my grandchildren, Jason and Kiana, and you may not have heard me mention of them in a very long time. And yes, Max and Taz are still very much a part of my daily life. Those are our doodles. So I'll tell you more about them. In today's episode, I'm going to dive a little deeper into several things I touched on just now, but let's start with a few personal updates. Grief and how I'm carrying it. So my husband and I decided with some intention on taking our long extended break, our travel, our vacation in the month of May, which it was extremely challenging for us last year for so many reasons. So not counting all the things we were dealing with professionally with this administration change and what that did to a lot of our work and our businesses, not even counting that, the month of May is complicated. So we've got some really highs that we celebrate, and then we've got some very triggering moments in that month. So our anniversary is in that month. My birthday is in that month. Of course, you have Mother's Day, which is both exciting and then a little triggering because I lost my mother in 2023. And then we've got my bonus son's birthday. Our son's that we lost in a motorcycle accident. It's been about a year and a half now. I talk about that to you all through this podcast. And as I'm navigating this complicated journey of loss, so last year was just really extremely difficult for us to just try to manage our emotions. We had no idea what we were feeling, and we had no idea that it would be so triggering in that month. So this year, we intentionally just wanted to have space for however we were going to feel and whatever came up, and really try to celebrate life and their memories, but also just having space for those moments when it was really difficult. So we ended up having a wonderful time. I'm really grateful that I have a business model that allows me to pick up and take the work with me. So as much as I would love to say to you that I was able to be off the grid, I did no work for a month, that didn't happen. But I was able to organize my work along with the way that we traveled so that I could meet my clients' needs and deadlines and do the work that needed to be done, manage my team from where I traveled, but then also have a lot of time in there to completely unplug and be present with our environment, with my husband, And we even had a group of friends. We are part of a grief group here locally, and they decided to take an Alaskan cruise. So for a week, we joined them on the cruise. They flew to Seattle. We drove cross country to Seattle, and then we got on the cruise ship for a week and explored Alaska, which is absolutely gorgeous. I highly recommend if anybody's thinking about doing this trip, or if you've done it, you already know that it's fantastic beyond words. It was one of the most expansive trips, if that makes sense. We saw scenes that just looked like they were out of a movie. It just didn't seem real, but it was just so beautiful to be experiencing nature in that way. And so during that time on that cruise, we celebrated my mother's her birthday and those memories with our grief group, which was really comforting and nice. Then after we finished the cruise, we dipped down to California, Northern California, and visited the redwoods, which was beautiful. As both that park was on our list of places to go. So the day that we explored that park was our son's birthday. So we were able to just really feel the whole wave of experiences and sharing lots of wonderful memories of him, and just being able to enjoy that time together was really, really special. And then we just took our time and drove back across the country from West Coast to the East Coast, sort of across the middle of the state. So we just saw such beautiful country. My husband's a retired truck driver. And when he was over the road years ago, he would always say he's making a note of all the beautiful places in this country that he'd like for us to visit together, once we retired. So we're not technically retired, but it was just an opportunity to include, just really build a wonderful trip around that whole experience. So we literally were away from home for a full 3 weeks. And then we just had some buffer time around that. So we just essentially had the month of May to explore and to relax and to reset. And it was absolutely wonderful. So I like sharing that with you all because I think it's easy to see someone just doing all the work and forget that there's a team. So shout out to my entire team for really making this possible. There's no way I could have been able to do all that and meet all of the deadlines and get these episodes out to you on time and show up how I needed to show up without a wonderful team that I have. And then also, I think it's nice to also give you updates because I share my grief journey and I don't go into this all of the time, but I think it's important to bring it up because unfortunately, a lot of people feel like they have to keep packing that down. After a few days of the funeral, after some time passes, there's this thought that you need to get over it. I'm using air quotes, but that's not true. It's a part of your journey of life, and we will suffer losses. We will have people come into our life, and we will suffer loss. So that is something that, as public health professionals, I think it's really important that we begin to normalize that as a part of conversation as well. So it was really, like I said, a wonderful trip. And I'm just so thankful for the opportunity and tons of photos and videos that helped me relive all those moments. I also had a wonderful opportunity to visit one of my clients in office. One of my oldest clients is in Seattle, Washington, the Seattle Indian Health Board or Urban Indian Health Institute. I was really excited to meet them in their office. Now, I've met plenty of the folks that work there. We usually meet in person at other conferences, but that was the first time that I was able to join them in their office in Seattle. And I've worked with them for several years. And it was interesting we had our meeting in the conference room. Instead of it being via Zoom, the team is in the conference room or walking in around their desks. I was able to meet with them there in person and just recognize so much of what I've seen over the years on our Zoom meetings. And I have such a wonderful relationship with this client. I think we cultivate this with all of our clients. It's a sense of family and closeness. I'm honored to be able to support and serve this client organization. I'm such a fan of the leadership and the work that they do and the mission of the organization that I'm here whenever they need me. And it is just really an honor to be invited often to do the work. So to sit down with them, and it was on my birthday, which was a special treat. It just kind of worked out in the schedule. I was able to work in the office that morning with them. And they even brought in fresh muffins at the clinic. They do a lot of cooking, and it's just amazing how they serve their clients and their relatives. I should say patients that come in, they call them relatives. So it's just wonderful to hear them, to get to know them, but then to just be present and sit with them. So they made muffins and brought into the conference room. And so we had our meeting, we did the work, and we had a chance to just fellowship for a little bit. and took some photos. So that was just really a special treat. As much as I would love to be able to do that all the time, it's not always possible, but I'm really grateful for those moments. And I wasn't able to, I know I have a lot of colleagues in Seattle and around Seattle and in even some of the places that I traveled through, but I didn't have the ability to stop everywhere, but I was able to make this happen. So really, really excited for that. So much. A lot of these reflections and prompting to share these updates, it was kind of born out of that trip as I thought about what's next for the second half of this year and all the things that are going on. So that's a bit about my travels. I also I have not given many updates about my grandchildren. So many of you will ask about Jason. I've talked about him since he was first born. Jason, at the time of this recording, and I'm recording this pretty close to the time that I'm releasing it. So this summer, Jason will turn 5 years old. And I know a lot of you are probably gasping, like, oh my gosh, is he that old? Yes, he is turning 5 years old this summer. And then Kiana, my granddaughter, will turn 3 years old this summer. And they're so much fun. Yes, I'm that grandma that gets into a lot of trouble because I don't say no. And I think going through the twos with Kiana has been so much fun. She's got a lot of leadership qualities. We didn't say it like that back in my day, but now we say leadership qualities, AKA she's a little bossy. She likes to be in charge. And I love that for her. And we have so much fun. So we've been enjoying a lot of time together. The kids live very close to us, so I get to see them a few times a week. And I've gotten quite spoiled by that. But they've just been such a delight to have around and to do things with. And of course, I'm excited about Jason starting kindergarten. He just completed a 4K program, but he goes to, I guess, the big school this fall. And that'll be interesting to navigate as a grandparent. I'm not sure what to expect, but I'm excited about that. I'm just glad they're close enough that I get to enjoy them. And then also, I've told you all about my doodle puppies. They are 2.5 years old now. If you remember me mentioning a while back that I have these, I'm saying puppies, they're not puppies. And in fact, I guess a fun fact, when we decided to adopt this time around, we wanted puppies because we had lost several of our dogs and the last one we adopted was older. So we wanted to kind of increase our chance of having more time. And they were supposed to be mini doodles, but they're double the weight that they were predicted to be. They were predicted to be like 22 pounds, and they're both in the 40s each. So we have some nice medium-sized doodles. They're super, super cute, and they're very naughty. But they did go through obedience training. We have a great trainer who trained the puppies and also us. But they do listen to their basic commands, and they're pretty well behaved, but they're just doodles, and they've got their very interesting personalities. But they're very much an active part of my everyday, and it's really wonderful to have them. I don't get to bring them up very often, so I thought I would just give you all an update on our doodle puppies. They are about 3 weeks apart in age, but they're both 2.5 years old. So we have our hands full between the doodles and the grandbabies, but that's really nice for us too. All right, so let me tell you a little bit more about the book. I know that if you've been following for a while, this has been such a long journey. The traditional publishing route is definitely like a whole thing all in its own. But I'm grateful for this experience because, well, just for all the reasons. I think there's so much that I thought about and trying to make the decision, but I feel good about the decision. The timeline, I really wish it could have been happening a whole lot faster, but everything happens in the right time and for a reason. So there's so much that I've gained in this journey and over this experience as well. The book itself, the title is The Public Health Consultant, Expertise, Entrepreneurship, Greater Impact. The pub date is scheduled for December 15th of 2026, and my publisher is Johns Hopkins University Press. Very, very proud of what has evolved over the years of creating this book and revising, and the whole team that has taught me so much along the way. And I'm still learning because we still have several months before it releases, and there's just so much happening in the background that I'm just trying to absorb it and be here for it and appreciate it. So this book explores what's possible at the intersection of public health and entrepreneurship, and how we can lead in innovative ways to serve communities and have the impact that we're all looking to have on these communities that we care so much about. There's always an interest in this topic for years, as I've been consulting for a very long time. And I've noticed that so many people are just curious about this topic. A lot of folks I've been able to, help with getting started with businesses that are doing extremely well. And other people just, there's so many questions. There's still not a lot of clarity around what it really means. And I think some people, especially now that we've been through so much as a public health industry, are not even confident in exploring what's possible for them. So I think this book helps you do that and answers a lot of those questions. And it helps you to take your own expertise and your interests and explore what's possible and maybe even like turn the light on for you and inspire you to take some of those next steps. So let me share this with you also. I mentioned that I had a conversation with Kamala Harris, and this was a surprise. I did not expect there to be a deep conversation, but I say deep conversation because she really, in the few moments that we were able to talk, this was a face-to-face meeting. I've shared pictures on social media of us together, but she was so inspiring. She looked at me when she asked me about, my book, what's it about? And when I explained it to her, she said that this is so important. This is going to help so many people. And she went on to just pour into me the importance and significance of this book and how this will help with all the things that I've just explained to you, the inspiration that it provides for people that are looking for what's next or what's possible. I think that initially I was starstruck and I was in awe, like, oh my gosh, she's talking to me and this is great, like anybody would be doing in that moment. But afterwards I thought about it and I thought, that was so encouraging to hear, because I'm imagining some people, we're all aware of everyone in the news, people outside of our immediate industry are aware of how we're being dismantled. Not very many people talking about what we're doing and how we're rebuilding and what's happening. And surely not enough talk about the amazing people who are consulting and walking along this entrepreneurial path. So I think that this was refreshing for me to hear, and it encourages me. And she encouraged me to continue to be very vocal, to speak up and to be present and to really go all out with this book promotion so that, it has the potential for helping so many people. So I share the full story about all the details of that conversation inside of our private community. But I wanted to tell you all here on the podcast, that was very encouraging to me to have that conversation with her and to get her reaction to the book and the topic and so forth. And to know that, I knew we all can tell that she supports science and public health, but to experience that was reassuring and rewarding for me. And hopefully you can just feed off a little bit of that as I share this story with you. Okay, so let's talk a little bit about public health entrepreneurs. I have a second podcast and I need to look it up. It's been a little over 2 years, but it focuses completely on the journey of public health entrepreneurship, being a consultant, walking that path, shares tips. And, if you have been on this podcast for a long time, back in the old days, I used to include those topics on this podcast, but I decided to separate those because it is a separate business and a separate focus, so that people who want a deeper dive on that topic has a whole podcast they can jump into. And then everyone else can stay here, or you can listen to both depending on, you may need something from this podcast, but then you may want to supplement with things from that podcast and those topics. And I still have resources, whether it's mastermind programs or coaching services that we provide to people on that path. So that is its own separate. And you may be confused because maybe you've seen across social media referencing podcasts, or you kind of hear about them both, but you maybe assume they're the same, but they're two separate podcasts. So Public Health Entrepreneurs is for anyone that's interested in the topic of entrepreneurship and consulting, running a business, starting a business. That podcast is for you. And then everything else is here. So I'll have some links to that in just a little bit so that you can explore what's there and what's possible. But I just wanted to distinguish that so that moving forward, then you understand that there are two separate podcasts. And yes, we produce episodes for that podcast every week, but it falls on Thursdays. So just to make sure that everyone's clear, we've been pretty busy as a team. Okay, so let's talk a little bit about the podcast, the PHEC podcast community, and why it matters. So as I mentioned earlier, if you really want to hear the details of my meeting with and conversation with Kamala Harris, then I really dive into it there. The members of the community, we got together and I just shared move step by step, like what happened in the day and what we did next and what happened then. And so I went through the whole thing there. So if you're interested, all of those details are there. But in this community, also, if you've been following, we've been talking about this community. I mention it almost every episode. We've moved from different social media platforms, and then almost, I guess, about a year and a half ago, we invested as a company, invested in a private app to support this podcast. So the PHEC podcast community has its own app. You can go to the App Store, download the app, and you can join the community there, or you can join the community on desktop. Some people, will do both so that when you're on the go, you can access it easily. It is a space for us to be connected, to engage, to be very social, but it's not connected to a social media platform. So you don't have to be on Facebook to access our community. We wanted to make sure that our global audience of people that listen to this podcast and may be interested could easily access the community, even if they're not on any other social media. So that was really important. That was by design. So members that were interested helped me. They put their feedback in. We created this together. Then over time, the community began to grow and take shape. So right now we have multiple spaces within this community where you can go and connect with others, join a conversation. We have live events in the community that happen on a regular basis. And I'm going to tell you about some of our partners in just a moment on the topics that they lead conversations with in our private community. But on top of those events, we have co-working, virtual co-working, which has turned into such a vibe in its own energy. I love it because you get a chance to do the work, stay focused, but we're connected because we're logged in together. It's something magical. If you've never experienced it, you just have to experience it once to really get and understand what we're talking about. But it's a wonderful way to stay connected and be productive. And with a little bit of accountability, you can turn your camera on or off. I usually leave my camera on because I get distracted. And if the camera's on, then I'm not going to get up and pop around the room. I'm going to stay seated and work on what I need to work on because you're going to be watching me. So to me, that helps me stay focused in that time, but you don't have to have your camera on. But that's just one of the events that happens in there. We have a book club where we can share recommendations of good book that you're reading that you want to share with someone else. It may or may not be a specific public health book, but it may be something that helps with professional development or just one for pure entertainment. It's just a great way to share about a book. And sometimes we distinguish, whether it's Audible or if it's, physical hard copy, because sometimes a lot of us will consume audiobooks on the go, and there's pros and cons, but we talk about a little bit of that in the book club, just depends. And that's an asynchronous space, so you don't have to be live for any of that interaction. Now, we also share wins and updates about what's happening in your work world or in your, business, whatever you have going on. It's a place where you can share updates or ask questions if you're wrestling with something, because everyone in there we're all public health. And we have some partners that I'm so excited to have in this community. Now, a few months ago, I reached out to them and I picked folks by their energy. Like, these are people that I initially reached out to because I see that they're doing something different. They are taking their energy. Maybe it's from the frustration of being fired by CDC and they've turned it into something that is helping and filling a need. And I invited that leader, like Abby Tai is example. She's leading Public Health Coalition. She's been on the podcast before. Her initial organization, which I think is still, the initiative was Fired by Fighting, and it's a group of CDC professionals who were fired by the Trump administration, and they decided to do something with that energy. So at any rate, she leads a group of discussions. She brings on a panel of her colleagues, and we talk a lot about advocacy and what that looks like, because depending on where you are, your energy for advocacy could be really high, it could be really low, but there's something for everybody all in between. And we just talk about what's relevant and what's now. And in this important election year, these topics are so important. So we're having those kinds of topics in the community, those kinds of discussions. She leads those topics. So excited to partner with them. Also, we have Selena Smith, who is on the board for Black Ladies in Public Health. She leads a variety of topics on leadership and what it means to really focusing on leaders who are very high functioning and doing so many things, spread so thin, and how do we take care of ourselves? It's a real gut check, a time to kind of reflect and really take in a few moments of how we can do this better so that we're not exhausting ourselves trying to take care of and save everybody else, and then we're getting like worn out in the process. And these are challenging times as leaders. So you all know that. Those discussions are just really, really refreshing and wonderful and almost therapeutic. But it's wonderful to have she and her group that come in, and it's a different group of panelists that speak from month to month. So she leads those topics. And then we partner with Dr. Cynthia Castle, who leads Healthy Futures Foundation, which is really about rebuilding maternal child health and incorporating AI and really having those conversations that we should be having in public health. And it sometimes feels challenging. We're not waiting for something to be finalized and pretty. We're just talking through the situations as they are. So these are just some examples of the partnerships that we have for the topics that we're covering inside of our community. So there's something going on every week in the community, and you can join live and interact, or you can catch those recordings because they're housed in a library for you. And then we just have good old-fashioned networking sessions where we get to know each other and practice some introductions and really just get to see who's who and who's doing what work and where they are. And oftentimes just finding ways to show up and support each other. So that gives you a little bit of deeper dive into what we're doing inside this community. And I will also add, and I say this on every episode also, but when you become a member of our private community, you are supporting the production of this podcast. This podcast is made available to you for free through the platforms, but it is not free to produce. It is actually extremely costly, and with the time and the actual resources that it takes to produce, edit, distribute these episodes and maintain all of it, there's a lot involved. So the membership in our private community, not only do you benefit from being in the community, but it also supports the production of this podcast. So that's a bit more about the community. I would love for you to become a part of that. And it is also where I will share more details behind the scenes as I continue on the journey to the pub date for my book, which is amazing. But it's where we stay connected. And I just wanted to make sure that you had an opportunity to fully understand that and how it supports and how we can all come together. We're better together, leveraging this platform to bring these voices together. And then the same that I do within the community, the podcast itself. It's just really wonderful, and I feel it. I see how we're growing constantly in not just size of the group, but in the richness of the conversations and the connectedness. So thank you to all of our members who are a part of the community right now. And I encourage any of you who are thinking about it to explore that opportunity for yourself. You can find the links to everything I shared with you in this episode on the show notes page for this episode, which is episode 463. You can just go to phecpodcast.com. Once you're there, navigate to episode 463 to find the show notes and the links to everything that I talked about. And if you have any questions, you can't find anything, then from that same site, if you look in the menu, there's a contact us. You can reach out, send us a message, and we'll respond. That goes for any social media platforms where you may find us. If you have any questions about something that you can't quite find that I've mentioned, just reach out to us. My team is always available to guide and respond, and I just think they're amazing. Okay, well, you are up to date. And until next time, have a fantastic rest of your day. Thank you for listening. The show notes page is where you'll find links to everything we discussed in this episode. To find the show notes for all of our podcast episodes, just visit phecpodcast.com.